appearance of reds and browns on one's face happens sometimes slowly over time. In fact, sometimes you look in the mirror and all of a sudden it's there. So reds are typically little vascular areas, like little blood vessels on your face, particularly around your nose. And there are other pigmented places or brown spots on your face, and we typically call those age spots. So sometimes these areas can be treated with skin creams, and sometimes they need something just a little bit more than that, particularly the red areas. So we now have a Cutera Zeo machine. This is an amazing machine. We've been very pleased, and our patients are very happy with the results as well. So on this specific platform, we have an IPL machine. We call it Limelight. And for the Limelight, this is the one that we can use for treating areas of redness, which are the veins or the vascular areas. Also rosacea, which has a vascular component to it, which is kind of a diffuse, redness. And then we can also treat some of those brown spots or pigmented spots on your face. So the ideal candidate for this would be somebody that has a little bit lighter skin. So for somebody that's African American or darker skin, this would not be good because it would target that pigment and create light areas. So this would actually be good for somebody that's a little bit more lighter on the skin color. So with this treatment, we basically put some gel over the top of your face and then we treat. And then slowly over the next several days, some of those pigmented areas will just kind of lift off. And it's possible you might need several treatments. It's probably like, 3 to 4 treatments for really seeing a very significant improvement. The other thing is that for the reds, which are the vascular areas, sometimes it requires a few treatments for those as well. You might see that the little veins occlude or become a little violet at first, and then your body actually has to resorb those. So that one's definitely a process. But I think if you're able to treat some of the browns and some of the reds on your face, you'll see some pretty magical improvement. Some of our patients have been ecstatic about the results. They've been living with pigmentation for so long. Even we find that some of our patients have been tanning and have continued tanning in order to kind of disguise the browns that they have, which is exactly opposite of what you should do. You should try to avoid being in the sun, number one, to prevent skin cancer, and you should be using some sunscreen, not tanning even more to help to try to disguise those brown spots. So the Limelight has been really magical for our patients, and I bet that you would have a nice result too.